Well, I'm here in Cairo, finally. I got to meet Ibrahim. It was a bit of a tough journey because I got in Cairo very late and we missed connections and things, but we're here now.
Yeah.
Pyramids behind us. As an Egyptologist, I mean, how fascinated are you by the Ebers?
I am very fascinated by this Ebers Papyrus for two main reasons. The first one is a complete one. We didn't find, to be honest with you, a papyrus scroll that is complete. Not one piece of it is missing. That's one thing. The other thing is how much it covers in medicine. And what really drives me crazy is the fact that many of these prescriptions we still use till now, like a guinea worm. Guinea worm, it describes that if you have a guinea worm, you tie the end of the worm on a stick and pull it out gently. A practice that was known 3,500 BC, still used till today.
So with the urine aspect, I mean, you've probably read the Ebers Papyrus and never joined the dots.
Yeah.
And then when I've come up, did I join those dots for you when I was talking about the urine aspect? Did you actually go, actually now I remember back in my...
I had the idea about Ebers and I had the idea about the urine, but I did not get deep into it until you called me and you told me, so I had to do more research.
Like most people, I must say, most people forget about urine therapy. They don't understand, or it's just one of those things when you reflect, you remember your parents or your grandparents.
Exactly. I was amazed when I started to remember from the past, we did that. How come, I forgot all about it. And also at the same time, people sometimes, I think it's a war waged by the pharmaceutical companies to destroy anything that's from the nature or could heal people for a very cheap price or something that anyone can apply. And then they ridicule people who talk about that, there have been...
I know.
Seems like you had some experience.
I mean, because back then they also had cancer as well, didn't they?
Tumors,
so,
talk about tumors,
So we're not resolving that at all.
No.
Even today, we've still got more.
If you pay a visit to the Egyptian Museum on the second floor, on your way into the mummy room, they have surgical tools they have used to carry out a concussion operation in the brain. There is the skull where the concussion operation was carried out till now in the Nubian Museum in Aswan. And this talks about something like at least 5,000 BC, which is 7,000 years ago.
So what do they use for antiseptic? They probably use urine as well because it's antibacterial antiseptic.
I cannot be, I have to be specific. But they have used lots of herbs and sometimes to help them during the surgery, they gave them a patient opium and it was, and it was, there is a scale, you can see the very fine scale to weigh how much medicine you have to take.
So we're going backwards. I
think
a little bit.
I would say we need to dig deep in the past because we will learn a lot.
Well, these papyruses are
exactly. We need to, like what you do, and I'm very proud of you for doing it, to shed more light so that people know about the past and learn from the past, because it's not all of a sudden out of the blue we invented medicine. It's something that has been known thousands and thousands of years ago, and we need more people to keep digging out these gems and jewels and bring them to the light so people learn more and benefit from them.
It's all there. It is all there. So how many old? 3,000 years old papyrus?
The papyrus of Ebers is exactly 3,562 years old.
So they do testings on that, do they?
We have carbon dating. You can carbon date, and also for this one we had the date written. We had the date written on it, like 1,552 BC written on it.
But what you were saying before was it could have been a copy of one even older.
Yes.
So this
we know for sure. Why? Because it talks about a king with the name Den, and then as a pharaoh, he was in the first century, in the first dynasty. First dynasty, we're talking about 3,100 BC till 2890 BC. So we're talking about something, a medicine that could be more than 5,000 years old.
So urine therapy, I would say, be around since the beginning of time.
I would agree to that.
Absolutely.
As an Egyptologist, I would agree to that.
Well, thank you,
welcome.
Much for meeting me.
You are welcome, anytime.
Thanks everyone for tuning in. It's been an incredible journey here to Cairo, and I went down to Luxor, as you saw earlier on as well. And thanks for tuning in and keep watching. I will endeavour to get this film done very soon. I'm very close. Okay, I promise.
I wish you all the best. Best of luck to you.
Pleasure.
Thank you.
Thanks.
Take care. Bye.
Cool.